finishing up NP school soon and you're starting to look into certifications and realizing that you could take a test at two places like the AANP or the ANCC, and that just seems crazy to you and you have no idea which one to pick, you are not alone. In this video, I'm going to explain the differences between the two. I've been researching this because I had no idea. So in this video, we're going to look at the AANP and the ANCC tests that you can take in order to become a nurse practitioner. So if that's something that's been confusing you, this video is for you. Hey everybody, I'm Liz. Welcome back to my channel. I make videos about my journey to becoming a nurse practitioner, some stuff about nursing, being a mom, cloth diapers, all sorts of stuff. So if they're into that, make sure to subscribe below and let's get into the differences between these two pretty confusing topics. Okay, so I have no idea why two different credentialing bodies seem to be fighting over some of these certifications. It's totally confusing to me. Some NP specialties only get accredited by there's only one test you can take, and if you are one of those people, I am so jealous because it makes no sense why we have to pick which one. That would be like having two options for the NCLEX. It doesn't make sense. Needless to say, some people do need to pick, mostly if you're a family nurse practitioner or an adult gero. Those are your two big ones that you're gonna have to pick, AANP or ANCC. So let's first talk about the ANCC, the American Nurse Credentialing Center, and that is the organization that is associated with the American Nurses Association. The ANCC, and if I'm gonna mess those up at some point, so just let me know in the comments if you see an error because they're way too similar. ANCC offers the following certification exams, and I'm gonna read them off of here because I don't have them memorized. Family Nurse Practitioner, and I'll list right here what it would look like. Adult Gerontology Primary Care, Adult Gerontology Acute Care, Pediatric Primary Care Nurse Practitioner, and Psychiatric Mental Health NP. So those are the 5 different nurse practitioner tests you can take in order to become certified by the ANCC. Let's talk a little bit about the ANCC exam format. So this one is going to have more questions than your AANP. There's going to be 200 questions, of which only 175 are graded. So it's a lot like the NCLEX, where when you took it, there were those 15 questions or whatever that weren't actually graded. They were for research for future questions. That's similar on both of these exams. They both have these practice questions for the future. And you have 4 hours to take this test. This test has different formatted questions than the AANP. This will have more choose all that apply, a lot of click and drag drop questions. They'll have a lot more pictures. They'll show you EKG strips and ask you to read them and interpret what you would do in a certain situation. They're going to have pictures of wounds and skin and rashes and being like, hey, look at this, what would you do? A lot more drag and drop type of questions, and interpreting x-ray films. Now we'll get into kind of information about the test that makes it a little bit different from the AANP. So the ANCC does not give you normal lab values. They could throw out something and be like, a male walks in with a hemoglobin of 9, blah, blah, and then go through the question, and it's not gonna say what your normal hemoglobin level looks like. So you would have to know. I have been told by people that took it that they don't give you anything that's borderline. So they're gonna give you something that's real low, real high, or nothing that's right on the border where you're like, I don't really know. But that being said, you do need to be familiar with, struggle with that. You might want to maybe consider the AANP instead. Possibly the biggest difference between the two tests is the ANCC includes non-clinical questions. So those are going to be things about nursing theories, research, evidence-based practice, insurance, Medicare, Medicaid, things like that. That is going to be included in there. I've read, I think it was saying somewhere up to 33% of your test could be that. So if that's your jam, awesome. And if it's not, maybe not. When you're going to purchase the test, if you are a member of ANA, you get a discount. Or if you purchase the exam and you go to sign up for ANA within 5 days of buying the exam, then you'll get a discount. And finally, we're gonna look at recertification. So you're gonna recertify every 5 years as a nurse practitioner. When you're recertifying, the requirements for the AANP and the ANCC are different. So for the ANCC, you have to complete a mandatory 75 CEU hours, regular like you would with nursing, but in your specialty. And then you have to do 1 or more of the following on this list. So I'm gonna read this one again. Academic credits, so if you were in your doctorate program or something, you could apply those. Some kind of presentation, if you go to a poster conference, anything like that, and you're presenting research, that counts. Evidence-based research, again, you're doing research for the poster maybe you presented. Precepting hours, this is always a popular one. Professional service, that's volunteering. Practice hours, so when you're at work, any of those hours count. Or you could take the exam again. So you'd have to pay for it, but you would sit for the exam again, and if you pass it and you've done those 75 CEUs, you're golden. That seems really stressful to me though, and you might as well just do it the other way. It might be a good idea if you're looking into like maybe not working full-time, if you want to get a job at an academic institution where you won't necessarily be practicing with a ton of hours, then this might be a really good option to look into because there are other ways to get recertified other than having a ton of clinical hours in practice. All right, let's take a look at the AANP. So this is the American Academy of Nurse Practitioners Certification Board, and they are affiliated with the American Association of Nurse Practitioners and also of the American Academy of Emergency Nurse Practitioners. But I feel like I'm like, all these words are the same. They offer the following 3 exams. So they offer family nurse practitioner, adult gerontology primary care, and emergency NP. So same as with the other one, if you enroll with AANP within 30 days of purchasing the exam, then you're going to get a discount on the price. This one you have 30 days as opposed to 5, or you can join before and you get the discount. The exam format. So this one is going to be 150 questions and they're almost all multiple choice and you have 3 hours to do it. So just highlighting the difference, the AANP, all standard multiple choice. Here's your 4 or 5 options, pick one. ANCC, choose all that apply, a lot of drag and drop, look at this picture, do all of that. The questions on the AANP are almost all clinical based. So one thing I've heard is some people think that this is a benefit for new providers because you don't quite have all the knowledge of the Medicaid, Medicare, just like ethics, all of that. That might be a little bit rusty, but you just came fresh out of school, so you have a little bit more of the clinical knowledge in your head, but it really is just up to you, I think. Like, which one are you better at? Recertification with AANP. So with the AANP, you have fewer options than you did with ANCC. AANP is going to give you 2 options. You can, 1, have a minimum of 1,000 clinical practice hours at your job in your specialty, a minimum of 100 CEUs, of which you can get up to 25 hours of CEUs through precepting students. And then there's option 2, which is retake the test again. So looking at that one, if you know you're going to be in clinical practice and the hours are not going to be a problem for you, then that's a very viable option. The AANP does provide lab values for you once. So when the first time you encounter it, it'll say their TSH is, whatever, and write that down. And then they'll never give it to you again, but they will give it to you at least once what the normal values are. That way you can write it down and reference it again later. Those are the 2 summaries of those 2 exams. I'm gonna compare a couple other things for you side by side real quick. The passing rates. So this obviously changes every year. The last year we have data on is for the 2016 exam, and that was for the AANC, the passing rate for the FNP exam is 82% versus the AANP, which the FNP exam passing rate is 80, which if you look it up isn't really a statistical significant difference. And then for the AGNP exam, adult gero primary care test for the AANC, the pass rate in 2016 was 80% compared to the AANP's adult gero primary care test, which was 76%. And that was a statistically significant difference with the lower score being on the AANP exam. Those letters are all getting me like, blah, blah. I don't know what I'm saying. But just things I've heard. I'm on a couple discussion boards. So I'm gonna give those to you guys, but take them with a grain of salt. This is not like the end all be all. Earlier I was listing hard cold facts, and these are not hard cold facts. These are just kind of things you hear. So I've heard that the VA and some large hospitals only like AANC. However, I work at a pretty large hospital and I've talked to many people who are certified with the AANP, and they said it wasn't a problem at all. So I think it just depends kind of where you work. Again, one good thing would be is if you're thinking of looking in a certain area, start looking at jobs and seeing what they want. Just in case you live in an area that really, really wants you to take the ANCC exam, then you'll know. When you're looking at them, the AANC always seems to be the one that if they're going to have a preference, they want that one. It's the older exam, so that might be more what they're familiar with. Some states, I found, I think like 2 or 3, Oklahoma, and then I forget which other ones, require you to have an ANCC. So look into that as well. I think it's pretty rare, but you might encounter it. And again, I've talked to a lot of people who have taken either. I've talked to some people who took both, and they thought the AANP was a little bit easier because the clinical stuff was fresher in their mind. But I've also talked to people who took the AANP, failed, took the ANCC, and said it was fine. So all around, the tests seem challenging. I think you're going to be fine either way. It's crazy that we have 2 options. Final thing, in case this matters to you, which it matters a surprising amount to me, and I was surprised, was what your letters are going to look like after your name. So if you are certified through the ANCC, then you are going to be board certified. So after your name, it'll be FNP or whatever you are, BC. And if you are certified through the AANP, you're just certified. So it'll just say FNP C. So if you're really like have a certain thing in your mind, you're like, I want it to look like, usually it's people like, I want to be like, have the board certified on there. Can do the same things, same certification, but you're not board certified if you take the AANP, so you can't put the B. All right, hopefully that cleared some things up. If you have taken either exam, I would love, love, love to hear from you. Let me know down in the comments which one you thought was easier, what you thought about the exam, if you have any other tidbits, things that helped you decide which exam you were gonna take. I would love to hear from you. Thanks so much for watching, guys. Have a great day. Bye.